Achilles tendon disorders, essentially we've got tendonitis, tendinosis, and Achilles rupture. After having gone through foundations, you understand the difference between tendonitis and tendinosis. So again, another principle that I'm not going to strongly reinforce, something that you should study on your own. Tendonitis, tendinosis, Achilles rupture, as I said. A review of your tendonitis and tendinosis principles. Worse in the morning, pain only mild in the morning. Again, all of these would be significant review from your foundations. Observation, possible tenderness, possible thickening of tendon, tendonitis, and palpation, tendon pressure. So I cruised through this because we can simplify it quite a lot. This is essentially tendonitis or tendinosis of the Achilles tendon. And since you already understand those principles, you know exactly how it's going to manifest. It's going to be painful on the Achilles tendon in the same way any other form of tendonitis or tendinosis would be. Your differentiation is important only for your treatment. In tendonitis, we treat it differently than tendinosis. Depending on how you're practicing, be it primarily acupuncture or primarily massage, is going to then determine how or what specific interventions you use. It's very easy to identify though. It's a painful Achilles tendon. That's about it, based on our history. When the pain is helps us differentiate. You cool on that? Okay. Now, although it does say possible, this is a little bit more reliable. So with active range of motion, pain with weight-bearing plantar flexion, and I note weight-bearing plantar flexion because we, as we know from our active and passive testing, we cannot get them to actively plantar flex enough to truly stress out a muscle. So it's weight-bearing plantar flexion and possible, very unlikely, but possible pain at the end of dorsiflexion. With passive range of motion, possible pain at the end of dorsiflexion, quite unlikely because we would have to stretch it so significantly. With resisted range of motion, this is a bit more reliable. Remember, this is a contractile tissue we're discussing, which means possible pain or painful weakness with plantar flexion. Pain is hard to elicit though, due to the strength. Pound for pound, incredibly, incredibly strong. It was hard to resist plantar flexion enough to elicit pain. We have a very reliable test, and it's called the Achilles pinch test. You're never going to guess how to perform this test. Not in a million years. You pinch the Achilles. Try it. Pinch your Achilles right near the calcaneus. Just give it a little squeeze. Ow. Who says ow? Sage, of course, yeah. Not so much. That's indicative. Ow is positive. You pinch the Achilles tendon, shouldn't hurt. You should be able to really squeeze that thing without any pain. No, it should be really, really close to the calcaneus, but not on it. Right above it, yeah. We'll practice this on each other and I'll show you how to do it properly, but that's it. So again, I'm cruising through it because I want to talk about Achilles tendon ruptures, and then we'll kind of bundle it all into one big discussion. So a rupture then is a grade 3. Rupture is a grade 3. It takes a lot of force, of course. I really wish this thing worked better. It's acute injury, it's sudden. Tendonitis and tendinosis happen very gradually. The Achilles tendon rupture is not gradual, it's sudden. All of a sudden, pop. And you will hear a popping sound. Has anybody been around somebody who's fully ruptured an Achilles, a hamstring, or a bicep? Oh, it's loud. It's loud. I've seen an Achilles tendon and a bicep rupture, and really, it's like it's an audible. No, it's like it's more like a snap sound. It's very audible when it's a full rupture. Unless, of course, it's loud that you can't hear it, but you get the idea. So it's an observation, possible bunching of the gastroc and soleus, and we'll see an image here in a moment as the gastroc or soleus, usually the gastroc, bunches up close to the knee. Bruising around the calcaneus, significant bruising around the calcaneus, and then possible limp. Possible limp. Isn't that weird? We're talking about a fully ruptured muscle, and there's only a possible limp. Remember, within the plantar flexors, we have two primary plantar flexors, the gastroc and the soleus. And what tends to happen is we'll rupture one. And it's usually the gastroc, which means you're left with the soleus. And as we know, the soleus is much stronger than the gastroc. So you can still walk with a very mild limp, even if your gastroc is completely torn. It's a possible limp. If your soleus is torn, you'll have a limp. You probably won't be walking at all if you've completely torn your Achilles. All right, palpation. We'll palpate in large mass where the gastroc has gathered and a possible gap between the two. You might be able to palpate the gap itself. And here's an image now. So we see it bunched up on the right. That's the gastroc that's bunched up near the knee because it's fully ruptured. You know how to fix this? Fix it with massage and surgery. Yeah, of course, it's surgery. But actually, after massage, using their hands, the surgeon will push the entire gastroc back down and then do a surgery distally. High recovery rates. Very common in athletes. Very common. Particularly in athletes who are getting cortisone injections. Cortisone weakens connective tissue. Yes, it's an anti-inflammatory, but you get an athlete, a runner, for example, or a sprinter, let's use a sprinter, and they're developing Achilles tendonitis. It's very painful to run with Achilles tendonitis. So they've got a race coming up. What do? Inject it with cortisone, decrease the pain, but cortisone is not only a painkiller and anti-inflammatory, it also strongly weakens connective tissue. So they run on it, they don't feel it, and snap, there it goes. Active passive resisted with active range of motion. A partial rupture, weak plantar flexion, painful dorsiflexion, painful and plantar flexion. It hurts to either stretch or contract. A full rupture, weak plantar flexion, but note, just as weak. It's not weak and painful, just weak. Fully ruptured, there's no nerves anymore, so there's no pain. Passive range of motion, partial rupture, painful dorsiflexion as we stretch the tendon. Full rupture, increased dorsiflexion because there's no resistance in that movement. Resisted range of motion, painful weakness with plantar flexion depending on the severity. And there's a special test called the Thomas test, and we'll take a look at what that looks like later. Are there any questions about a ruptured Achilles tendon or Achilles tendon disorders?